To begin with, let's get you the COVID situation in the country. In the last 24 hours alone, 161,736 cases have been reported in the last 24 hours. 879 people have lost their lives to COVID-19. Yesterday, India had recorded 168,812 cases with 904 deaths. Now, to get more details, we have my colleague Sukirti joining us. Sukirti, the cases over 1 lakh now for 7 days as far as India is concerned, and over 1.5 lakh cases, 1.5 lakh cases over the last 3 days. It's the third consecutive day.
Well, yes, definitely the spike in cases continues in India. The only very small ray of hope is that yesterday our positivity rate was around 14%. Today it is at around 11%. So the positivity rate has decreased slightly, and one would desperately hope at this point of time that the trend continues. But it is very soon to say that one can relax, or in India the government can say that yes, we have started seeing a decline in cases. For those statements to be made, one needs to see the trend for at least more than a week, and that is not the case at this point of time. Over 1.61 lakh cases, with of course Maharashtra, UP, Chhattisgarh, Delhi, Karnataka. Out of all the top 5 states, at least 4 of them have recorded more than 10,000 cases in just the last 24 hours. Also, if you look at the deaths, again over 800 deaths in the last 24 hours, and especially if you look at a state like Chhattisgarh, it is at rank 2 in terms of daily deaths recorded. A much smaller state in terms of its population as well as its area, but it has recorded 132 deaths, and that is something the central government has also been pointing for quite some time, that the Chhattisgarh situation is extremely worrying because it is disproportional to their area and their population. And central teams have also visited the states and have pointed out the fault lines with the state health machinery. Those issues, the state has already been asked to address them. But definitely for India, situation continues to be concerning with in terms of the COVID cases as well as deaths.